Mazoe, it's heartbreaking to watch. Thailand was considered one of the success stories. Why has this deteriorated?
Good evening, Bev. It certainly was a success story with 2 outbreaks last year that were controlled, and life was largely back to normal until April, when that highly infectious UK variant of the virus made its way into Bangkok. The cluster started in the infamous nightclub district, and of course, because it's so highly infectious, it quickly spread. And the places that it spread to the fastest were the very densely populated parts of Bangkok, so the slums, the construction camps. Now we've also had a huge outbreak in the prisons in Bangkok and now more broadly around Thailand. So for this third wave of infections, there are 88,000 cases. There are still 41,000 active cases. All the other people have recovered. Of the people who are still active cases, 1,200 are critically ill, and there have been 500 deaths during this third wave as well. To give you an idea of how things are tracking on a daily basis, cases were stubbornly high at around 2,000 for several weeks while the country has been in a partial lockdown. Most things are closed, people are working from home, but now that's kind of risen up to about 3,000 because they're taking in those extra prison and construction camp numbers. So a worrying concern for this third wave in Thailand, Bev.
So what measures can authorities take to try and stem the transmission rates in those crowded communities like construction camps, prisons as well?
Well, in the construction camps, they're sealing off the ones that they can, where people live on the site of the construction site. Where people have to travel in, they're making sure that those vehicles only go to and from the camp and from the construction site. They're also increasing testing. There's a mass testing blitz going on, as well as providing more sanitation and hygiene measures for people in these close quarters. In the prisons, there's also a mass testing blitz that's been going on. They've vaccinated all of the prison staff, and they're trying to now source vaccines for the inmates. More broadly, with Thailand's vaccine rollout, there have now been 2.4 million doses administered so far, including to around 500 of Bangkok's monks. In the past couple of days, there has been a program to make sure that those monks who are in contact with the public a lot are vaccinated, and they can start to continue their lives as normal as Bangkok opens up more. The target is to vaccinate 5 million people here in the capital in the next 2 months. So far, about 10% of that has been done, and vaccination centres are starting to open up more broadly. In shopping centres, there's also one out at the airport.
Thais are also, Mazoe, taking advantage of this option that they can receive a vaccine overseas. Now, how does this help them?
Well, it's starting to emerge that some of the tour companies are offering a product where people can travel to the west coast of America, take in some of the sites and get the Johnson & Johnson vaccine for about 3,000 Australian dollars all up. But the Thai government is urging caution with this because some states are not offering the vaccine. So if you're not careful about where you research, where you go, then you might go to the wrong place. There's also, of course, the matter of the 2 weeks hotel quarantine on the way back into Thailand. So it's not as easy as just going on a holiday, getting a jab and coming back and life is back to normal. There are a number of considerations there as well. But Thailand is determined to make sure that the free vaccines are available to everybody here. It was a sluggish start to the vaccine rollout here. They're now trying to make amends for that. But at the same time, private companies are pleading to be allowed to administer vaccines as well, even if people pay for them, just to try and speed this up.
Interesting. Mazoe, good to talk. Thanks so much.